My name's Elaine. I've got osteoarthritis. I was first diagnosed with osteoarthritis when I was 25, but it really didn't start to impact on my life until I was sort of in my mid-40s. I've got arthritis in my knees and in my neck, in my hands, in my jaw, which I was most surprised about, and I've started to get some arthritis in my hips as well now. At the moment I'm on painkillers and anti-inflammatories, and they're working quite well, but managing my condition is a whole raft of ideas, and it isn't just the medication that I take. It's very important for me to balance exercise and rest, and to know that I have to allow for rest periods in my days, allow for rest periods in my week. I can do lots of things, but I can't do them one after the other. So if I want to go out with my friends, I have to rest before I go, and I have to rest afterwards. And I have to actually sometimes write that on the calendar. It's also important to keep socially active, so that you're out with people, so that your mind's busy, so that you're not focusing on your pain all the time, and to do things where you can sort of totally lose yourself in your activity.
Osteoarthritis, or OA, also known as degenerative joint disease, is the most prevalent type of arthritis. It's characterized by joint pain, swelling, and stiffness due to the breakdown and loss of cartilage in the joints over time. Cartilage is the tissue that protects and shields the bones in the joints. When bones begin to rub against each other, the friction damages the tissue and underlying bone and causes the symptoms of swelling and joint pain. While most joints can be affected by OA, it occurs most frequently in the knees, hips, and hands. Knee OA is one of the most common causes of disability worldwide. In its advanced stages, people may experience difficulty performing everyday activities and walking. Some symptoms of knee OA include pain during and after activities that worsens towards the end of the day and eventually leads to pain during periods of inactivity or while at rest. Limited range of motion, difficulty moving the knee forward or backward normally. Stiffness, especially in the first hour after rising. Swollen or enlarged knee due to fluid buildup and bone damage. Sensation of grinding and sharp pain when moving the knee. These symptoms can range from minor to severe. While there's no cure for OA, it can be treated.
Painful knees forced Ruth Young to move from a two-story to a single-story house.
Going downstairs right now is a major problem. I go down sideways at one step at a time.
The 81-year-old former college dean has lived with osteoarthritis for 50 years. She says medications ease the pain, but nothing really gets rid of the disease.
I think you have to keep moving, keep the sense of humor, and try to cooperate with the illness as much as you can.
Wisdom from one who's learned to cope with the pain and limitations of the disease.